I'm Dave Zobek, and I'm a pulmonary function technician, a respiratory therapist, and I have a doctorate in education. I'm going to cover issues dealing with CPAP and sleep apnea, and let's move on through this lesson. As we breathe, our chest rises, our diaphragm falls. This creates a slight negative pressure that pulls in the air and fills our lungs. On exhalation, we relax our chest, our diaphragm moves up, and the air comes out because it creates a slight positive pressure. So if you look at the graph there, you can see right at the baseline, which is atmospheric pressure, we have this breathing in, breathing out. A little negative in inspiration, and then a little positive on expiration. As we inhale, air flows into our lungs. It goes through our mouth and nose, down our oral airway, past our vocal cords, and into the bronchi, and then down farther into the bronchioles until it finally reaches the end point, which is filling up the alveoli. Along that respiratory tree, things can happen. We're going to be talking mostly about sleep apnea, and there's three types. Obstructive sleep apnea, we call it shorten it to OSA, is the most common type. This is where the airway becomes blocked during sleep, and usually it's our tongue that is blocking the airway. And if the breathing is blocked for more than 15 seconds, it's considered to be sleep apnea. Now, central sleep apnea is when you have a condition in the brain that fails to send signals for us to breathe. And so we just don't have that trigger. And the last one is a mixture of both. I'm not going to cover central sleep apnea or mixed sleep apnea. I'm going to talk specifically about obstructive sleep apnea because later on we're going to try and fix that problem using CPAP. Now, what is occurring when a patient falls asleep is the muscles in the airway, in the throat, relax. And this sometimes causes a reduction in the space for the air to pass through. And this is why you might see or hear snoring. Often it's due to overweight, obesity, or it could be enlarged tonsils or adenoids. It could also be a crooked nasal passage or other areas, but it frequently is the tongue that's getting in the way. Now, someone with obstructive sleep apnea will have some, if not all, of the following symptoms. They have excessive sleepiness during the day. That can also cause them to have a reduced focus on the work they're trying to do. They may have a restless sleep because the body is waking you up, saying, take a breath, take a breath. They may also have loud snoring, followed by this gasping, choking sound as they open up those airways. They may have headaches in the morning. Sometimes this lasts for several hours, and trying to get that oxygen back into the brain. Because they're breathing with their mouth open, they often wake up with a very dry mouth. They have possibly an increased need to get up and urinate. They may be irritable or frustrated. All of this is because of the lack of sleep that they're getting. Those symptoms are helpful in cueing us in that we may need to have a diagnosis, an official diagnosis of what's going on. And so one of the best ways is a sleep study. And this monitors our breathing during the night. It measures chest movement or nasal airflow. It records our oxygen levels during sleep. Also, it monitors our heart rate. So then that's followed up by a physical exam to check for anatomical things that contribute to sleep apnea, such as a large neck with a lot of tissue that can close off the airway, or the enlarged tonsils or adenoids. If you do not take care of this obstructive sleep apnea that you have, there is a lot of complications that can occur. You can have heart disease, stroke, type 2 diabetes, high blood pressure. And so what we want to do is to prevent all of that is maintain a healthy weight, lose that extra weight that may be aiding in closing off the airway, quit smoking, treat the underlying conditions such as nasal obstructions or enlarged tonsils. With partial obstruction, we're still breathing, we're still moving air down into the lungs, but we're going to start hearing this snoring as those airways narrow and the tissue starts vibrating as the air passes this obstruction or this narrowed area. But then eventually we might have a total obstruction. The breathing stops. It's blocked. We cannot get air down into the lungs. This causes the blood oxygen to drop. And this lack of oxygen wakes us up. The brain says, time to breathe. We either partially or completely wake up in order to take in a breath and fill those lungs up with air and oxygen and get the blood oxygen back up. These disruptions occur repeatedly throughout the night and causing us to wake up with that headache, with that lack of sleep. Some of the risk factors for getting OSA is age. We have an increased risk of obstructive sleep apnea with age until we reach our 60s and 70s. And by then, if you don't have it, you're probably not going to have an issue. Sex. Men are generally more likely to have obstructive sleep apnea than women, and especially men in their earlier adult life. The head and neck, patients with a thick neck, a circumference of greater than 17 inches, often have a lot more tissue there, and that tissue can compress that airway and get in the way of us breathing. Patients with a larger tongue or shorter jaw may also have a greater risk of getting OSA. Increased body weight, a higher body mass index, BMI, increases the risk of OSA. It kind of goes along with the thick neck because there's more tissue to block the airway. Cigarette smoking can increase the risk of having it. Hormone abnormalities, such as thyroid or a production of growth hormones that is excessive, those things can increase our risk of getting OSA. Additionally, how we sleep is another factor. Patients that sleep on their back are more likely to develop or have a worsening sleep apnea because it's easier for the tongue to drop down and block our airway. Family history of sleep. If your father had sleep apnea, then you might have a greater chance of getting it. Nasal congestion, nasal issues. Using alcohol or some medications can increase our risk of having obstructive sleep apnea. Now, as I said earlier, diagnosing sleep apnea is done with a sleep study. That's called a polysomnography. This is done overnight in a sleep lab or in a sleep facility that specializes in doing these studies. Now, you'll find that there's a multitude of sensors that they hook onto the head, under the nose. All of these things are used to track the breathing, track when you're awake, track your oxygen level, your muscle movement of the chest, identify the stages of sleep that you're in, and other aspects, other things that they look at. In a in-clinic sleep study, they can tell the difference between obstructive and central sleep apnea. And this is a key to knowing how they will treat this sleep apnea. Since we're talking about obstructive sleep apnea, the best and primary way of treating it is with continuous positive airway pressure. And that's a slight pressure to the airway. The patient breathes above atmospheric pressure. If you look at the graph, we're not at the baseline, which is atmospheric pressure. We're slightly above it, but we're breathing spontaneously. It's not pushing in and out air like you would to ventilate somebody. It's just a constant pressure that keeps that airway open. That pressure holds the upper airway open. It doesn't ventilate. The patient must be able to breathe in order to be on CPAP. The first sleep study identifies the fact that you have obstructive sleep apnea. But a second sleep study is needed to determine the amount of pressure, CPAP pressure, that will be needed to keep your airway open. So they bring in a CPAP machine with tubing, with the mask that you're going to be using. They put it on you, and then throughout the night, the therapists adjust the pressure until this sleep apnea stops. This is called titrating, and they titrate the pressure to what you need. The pressure that keeps the air open is only about 5 to 10 centimeters of water pressure, which is not much. The air pressure comes from that CPAP machine. It's delivered through a hose, and that hose is attached to a mask, and the mask is strapped onto the face. Okay, before I talk about the CPAP machine and the masks and those type of things, I want to jump ahead and talk about some of the other things that are used to treat obstructive sleep apnea. These are not always as good as CPAP itself. The first one is a mouthpiece. It's an oral device. You put it in your mouth. It holds the jaw, the tongue in a specific position so that it doesn't close off the airway. It's usually used in less severe obstructive sleep apnea. This is a good thing for people that have anatomical problems. They may not need the pressure, the mask of CPAP. It doesn't improve breathing as much as CPAP would. However, it can reduce snoring. So if your biggest problem is snoring, your partner might appreciate these oral mouthpiece devices. And it's also an option for some people that just don't want to use the CPAP or can't use the CPAP. It's only going to be used if it creates enough opening to prevent you from having those apneas. The mandibular advancement device is a device that is placed in the mouth at bedtime. This device creates more room in the back of the throat by pushing or pulling the lower jaw and tongue forward. To get an idea what it's like, it's similar to a mouth guard. The most effective ones, the best ones, are made by a dentist. However, you can find some of these over-the-counter units that you put in your mouth and set for yourself. The effectiveness is questionable. It may work for you. It may not work. But if you really want a mandibular advancement device, go see your dentist. As I said previously, individuals that are overweight often have excessive tissue in the neck, and that tissue compresses or pushes down on the airway, causing them to have sleep apnea. So if they can lose weight, they might be able to avoid having sleep apnea. So in December of 24, the FDA approved 2 weight loss drugs. Now, I'm going to say these names wrong, but you can see them there. Zepbound and Mounjaro, and they're used to treat moderate to severe obstructive sleep apnea. Now, these are the first drugs to be specifically approved to treat obstructive sleep apnea, and it's really a not treating it, it's helping individuals lose weight. 2 clinical studies were done with these drugs, and they found that there were 20 to 23, almost 24 fewer apneas per hour when they had the patient on this drug for 52 weeks versus patients that were given a placebo. It's not the... Now, another option, and this option is for the very severe cases of OSA, and that's surgical removal of tissue in the throat. Cutting away this tissue means that the passage is larger and less likely to be closed by extra tissue or the tongue falling back. Second one, which is used in less severe cases, is the surgical implanting of a device to stimulate the nerve in the tongue, and as you're breathing, when the tongue starts blocking the airway, it's tickled and the tongue moves out of the way, allowing the patient to breathe better. Sleep apnea device, which is not CPAP, and what I'm talking about is the Inspire. This is a power pack and electrodes, which must be surgically implanted. The electrodes go under the tongue. I'm not sure exactly where the power pack is placed in the body, but then a controller is used to trigger that power pack to start operating, and it will sense the patient's breathing. And if the inspiration becomes blocked, then the nerves of the tongue are stimulated, and the tongue then retracts away from the airway, opening it up. This is a device that's used for OSA and not for central sleep apnea. There are a lot of things on the market for CPAP, and most of those things that you see on Amazon or other places are of questionable value. and this is the one that I'm going to bring up now, is called a micro CPAP device. It's a small device that's placed in the nares. It has little tiny fans that drive air into the nose and down the airway, and they claim that it's pressurized air in to hold the tongue back. I doubt if it's effective because of the size and the design. It's also not FDA approved. And there is essentially no studies on its effectiveness. So be cautious in looking at something like that. Now, lifestyle changes can really help individuals manage these symptoms of OSA. Reducing your BMI by losing weight is the key one, but exercise can decrease the symptoms of obstructive sleep apnea, even without losing weight. And that's probably more in the mild to moderate sleep apnea. Altering the sleep position, avoid sleeping on the back, will be effective in many patients. And not drinking alcohol, especially before bed, so that you're not over-relaxed. Now, if you don't treat sleep apnea, you're going to have a reduced quality of sleep. You're going to have all of those issues we talked about earlier. Sleep apnea affects the oxygen levels in the body. This can cause cardiovascular diseases and problems such as high blood pressure, stroke, heart failure, heart disease, PVCs, which is our abnormal heartbeat. It can lead to metabolic problems such as type 2 diabetes and the pulmonary hypertension. This is high blood pressure in the arteries of the lungs. That places of strain on the heart. And it circles back to those cardiovascular problems. As I said earlier, sleep apnea can impair the memory, the concentration. That can lead to an increase in car accidents from patients being drowsy, can cause mood disturbances, irritability, may have a higher risk of depression. It can also cause non-alcoholic fatty liver disease, and that's increased fat deposits in the liver, and that can contribute to some serious liver damage down the road. Now, sleep apnea can also occur in children. In young people, it's more common to see it. And up to 1 to 5% of children have sleep apnea. Now, they can exhibit the symptoms of hyperactivity and difficulty in learning and other behavioral problems because of the sleep apnea and the loss of oxygen to the body and brain. Now, these symptoms of OSA might not be snoring like in adults. Some do snore. But there may be other things that occur, such as increased sweating, maybe even bedwetting or sleepwalking. If you don't treat it, if it's severe and it's untreated, it can lead to growth issues and other developmental problems. Some of this can be due to enlarged tonsils or adenoids, so they may not even be overweight, but they simply have enlarged tonsils or adenoids. And so here, surgery to remove that tissue can be very helpful. Now, CPAP is that mild air pressure. It's used to keep the upper airways open during sleep. However, It's not only used to treat obstructive sleep apnea, but it's also used in other critical care problems of ventilation and oxygenation. CPAP can also be used to treat preterm infants with underdeveloped lungs. So if you hear of CPAP being used in other patients, it may not always be because of obstructive sleep apnea. Okay, let's talk about this CPAP. We're going to be using a mask or a device that fits over the nose or the nose and mouth together. It's held on the face using straps to keep it in position. There's a tube that connects the mask to the CPAP machine, and this machine has a motor that creates an airflow that is delivered into the tube, up to the mask, and into your airway. There's often a humidifier to moisten the air so that you don't have this drying out of your airway. Once you have CPAP, you should use it when you're sleeping at home, when you're traveling, even when you're taking naps. It'd be helpful to keep those airways open and keep the oxygenation going. Getting used to the CPAP machine and mask takes time, it takes patience, it may take changing different masks and doing different things, but don't give up on it. The equipment provider that gives you the machine and supplies will help you find the most comfortable mask for you. Masks come in 3 types, and we'll talk about that in a few seconds. Nasal, full face mask, and nasal pillows. The first one here we have is a nasal mask. They look pretty much like the one that's being illustrated. It covers the nose and typically used for patients who breathe through their nose during sleep. You see the head strap that holds that in place, the hose that comes off of that. It can go down to the CPAP machine, or in some cases they flip it up over the top of the head, and that way when they turn in bed it doesn't get in the way. Nasal pillows are kind of a stripped down version of the nasal mask. These have small cushions that fit right into the nostrils, leaving the rest of the face uncovered. A lot of patients like this better because it feels more open, less claustrophobic. Both nasal masks and pillows are lightweight, they're more discreet, they're less confining, and they're also a good option for patients who like sleeping on their side. The full face mask covers both the nose and mouth. This is often necessary for patients who are mouth breathers, who have blockages of the nasal airway. It is more confining and a little more difficult to fit. However, some say it gives a better seal than the nasal mask. And it's best when the CPAP pressure leaks out of the patient's mouth if they're using a nasal mask. As I indicated previously, all these masks must be individually sized for each person. They have large masks, medium masks, small masks, narrow masks. They all have different shapes so that they fit your face the best, because we want to prevent leaks. And if you have a abnormal shape to your face, you would end up having leaks. We also want to prevent pressure sores. The mask should not be tightened onto the face so that it would be just uncomfortable. The different size masks improve the comfort, makes it easier, makes it more likely someone is going to use their CPAP device. And one of the things that do not allow or do not do for yourself is to tighten these straps up so that the leaks stop. If you're having leaks, then you probably need a different mask, different types of straps, different types of cushions. Hold the mask in place and make it more comfortable to wear and less likely to leak. You might ask, what is the best CPAP? There's a lot of different styles, different materials, different shapes. And really, when it gets down to it, the best CPAP is the one that offers a combination of performance and comfort for the patient. It is an individual for each person. The best CPAP is the one that creates a seal when held against the face. The right fit can vary with size and shape of the person's face and features. So there is no one CPAP mask that you can say, this is the best. It is only the best when it fits the best on the patient. What works for one patient may not work for the next patient. Patients with facial hair are going to have more problems with the fit, with the leaking of the air, because the hair tends to mat down, tends to allow the air to escape from the mask. The choice of CPAP mask may be affected by the pressure that the patient needs to keep his airway open. A higher pressure makes it difficult to use nasal masks or nasal pillows. They may not work with the higher pressure levels. Also, how the patient breathes. Definitely can't use a nasal mask or a nasal pillow if this person is a mouth breather. That how they breathe can influence the right mask that you need. And then it gets down to the individual preference. What the patient perceives is the best for them. Unfortunately, some companies that provide the CPAP supplies only have one style of mask, and it limits what the patient can try on and use. So it would be great if the company would provide all kinds of different masks for the patient. There are many different types of CPAP machines that provide settings that may work best for one patient versus another. Some have multiple pressure sensing or auto-adjusting pressure, or a ramp feature that slowly increases up to the prescribed CPAP pressure. All of these things are variations that might be helpful for the patient. Again, companies only have a limited number of these machines. It's also important for the patient to clean their equipment, their mask, their tube, on a regular basis. Some say every day. They should refill a humidifier with clean distilled water. They should also know when to replace the mask and tube if they become damaged or aged. If CPAP pressure feels different, they should be told to have a therapist check the unit. That gentle little CPAP pressure that's applied to your airway does have some side effects. This can include congestion, runny nose, dry mouth, or even nosebleeds, especially if you're not using humidity with the CPAP pressure. If you start feeling stomach discomfort or bloating, stop using your CPAP. You may be swallowing air. That pressure is slipping down into your esophagus. Contact your doc, the one that ordered the CPAP, and talk to them about this problem. Mask can cause irritation. Don't just put up with it. Contact the equipment provider because they can find ways to help relieve that irritation. Also, they can help you adjust to using the CPAP machine. Don't try it once and then give up. Give it time. Try and troubleshoot what you don't like about it. The additional side effects of using CPAP can be headaches. Sometimes that's caused by the mask being put on too tight, or the CPAP pressure is too high. That pressure can cause irritation, inflammation, and block your sinuses. If you wake up and you have dry mouth, check to see if the humidifier is working and has water in it. Skin irritation can occur especially around the mouth and nose, and more frequently when too high of a pressure is used to hold the mask on. Tightening down those straps can cause the irritation. Even wrong size mask can cause irritation of the skin. There are some long-term issues with CPAP. These don't happen very often, if ever. But one of the things to be concerned about is breathing in gases, toxic gases, that can occur from cheap plastics. If you get equipment off of Temu or Alibaba, that plastic may be cheap and it may release different chemical fumes. Also, if you clean your mask with chemicals, bleach or something else, that residue can be inhaled and give you some toxic gases. Reduced face growth, that especially can happen in children if the mask is too tight. It interferes with the growth of the facial bones, etc. Middle ear pain pressure occurs when air pressure goes up the eustachian tube. Tooth problems. This occur probably more with the oral appliance, like the mandibular adjustment device. Or in some cases, they'll use a chin strap to keep the mouth closed. Some patients have complained of chest muscle discomfort. Not sure what causes that, but that is a reported problem. Eye irritation can occur, and this especially happens when there's an air leak up by the bridge of the nose. That leak can blow air right into the eye, causing irritation. Claustrophobia. Some patients don't like the fact that they have a mask on. It can even get to be a panic attack. This often occurs when you use a full face mask that covers the nose and mouth. It makes them feel like they're being suffocated. In those cases, a nasal mask or nasal pillows, if it can be used, may help them. And along with that is this feeling of shortness of breath. You have this pressure pushing on you, and some people feel like it's making them have problems with breathing. I mentioned earlier about cleaning the device. When you get your CPAP device from the equipment company, make sure they show you how to disassemble it so that you can wash the mask, the tubing, the humidifier, or water chamber. That should be done weekly with warm, soapy water. Don't use bleach or other chemicals. Place the equipment on a towel to air dry, but have it away from the sunlight. Sunlight will break down some of the plastics. Look at the equipment on a regular basis and check for deterioration or cracks. And if those are showing up, then get a new unit. You should wipe down the external surface of the CPAP device with a damp cloth. Filters should be cleaned or replaced as recommended by the manufacturer of the CPAP device, but do inspect them weekly for accumulation of dust. Sometimes that's all you need to do is clean a bit of the dust away. Use distilled water in the humidifier. Don't use tap water or other types of water. Don't add scent to the water. Also, have a backup set of mask, tubing, filters. You never know when something can be accidentally damaged or broken. Well, we've come to the end of CPAP and sleep apnea. I hope this presentation was helpful for you. I tried to design it for respiratory therapists, for patients, and for other healthcare workers to educate them on both of these subjects. Well, for now, thank you for listening, and maybe you'll hear me on another